morning and good afternoon to our viewers in North America. A special good evening to our viewers in Afghanistan and around the world. My name is Damon Wilson. I'm Executive Vice President at the Atlantic Council, and it's a real honor to be here today and to help set the scene for discussion about the status and future of gains that Afghan women have made in the past 2 decades. Our first event in this series focused on how economic opportunities for women are a driver of peace and security in Afghanistan. This session in this series will highlight women and girls' access to healthcare and its essential role in stabilizing the country. The Atlantic Council remains committed to engaging with and supporting Afghanistan to support an inclusive peace process that ensures that Afghan women are central to the country's future. This has been a strategic focus of our South Asia Center to ensure strong U.S.-Afghan ties, especially as we navigate a complicated peace process. Joining us today is a remarkable group of leaders and policy entrepreneurs. We're delighted to have them on our virtual stage. Diwa Samad is a special aide to President Ashraf Ghani, former Deputy Minister for Policy and Planning at the Ministry of Health in Afghanistan. Welcome. She's joining us from Kabul. Mariam Bayat, Director of the Bayat Foundation, which has played such a crucial role in the country. Rear Admiral Shoshana Chatfield, President of the U.S. Naval War College, and a former Provincial Reconstruction Team Commander in Afghanistan with experience on the ground. Moderating this remarkable group will be Ambassador Paula Dobryansky. Paula is a board member of the Council's Executive Committee. She's Vice Chair of our Scowcroft Center for Strategy and Security. She's also a Senior Fellow at the Harvard University's Belfer Center, a former U.S. Undersecretary of State for Global Affairs, and she's been a longtime champion of Afghan-U.S. relations and a catalytic force behind this series. She's also a great friend, colleague, and mentor. So for all of our audience, we want to encourage you to follow this conversation on our various social media platforms. If you're on Twitter, please use the hashtag #HealthForAfghanWomen. Join the conversation. You can also submit questions via the Q&A box if you're joining us through Zoom. We'll try to get to as many of these questions as possible during the session. But with that, let me hand it over to Paula to kick off the program. Thank you.
Damon, thank you so much, and welcome to all, and looking so much forward to the exchange with our very, very distinguished panelists. First, I'd like to take a moment and put the topic into a little bit of context. Again, the title of this particular session is Support for specifically women's gains in Afghanistan, Healthcare's essential role in stabilizing Afghanistan, and a few data points that I think are important to put on the table. First, when one looks at the maternal mortality ratio, the number of women who die due to birth or pregnancy-related complications, well, there have been a number of significant healthcare improvements. Between 2002 and 2015, the percentage of pregnant women receiving prenatal care by skilled health personnel rose from 16 to 61%. And then between 2002 and 2018, the number of trained midwives grew from an estimated 467 to 4,000. And the share of births attended by skilled health personnel went from 14 to nearly 16%. It's rather remarkable in terms of those advancements. A few more data points. Senior US government leaders, practitioners, and researchers alike frequently cite improvements in women's access to healthcare as one of the most significant accomplishments of post-2001 efforts to improve the lives of Afghan women and girls. And according to the World Bank, the life expectancy of Afghan women has risen from 58 years in 2002 to 66 years in 2018. And let me give one last data point, and that is the issue of midwifery. Midwifery training gave women a degree of economic independence and also the opportunity to serve as role models in their communities. And it's rather striking in terms of how that has taken on and how that has had also an important impact in this area. I wanted to share some of those data points because we're very fortunate indeed to have three very exceptional leaders, women leaders who have had a real impact in this space. And I'm going to go with first one of the panelists and pose some questions, and then we're going to hear from all of them. Let me begin with Rear Admiral Shoshana Chatfield. She is the president of the U.S. Naval War College, and she's also former Provincial Reconstruction Team Commander. But let me say a word first in terms of her capacity as the president of the US Naval War College. She, in fact, is the first woman to head the US Naval War College in the history of that institution, which is something that we're very proud of. And also, by the way, in terms of her own career, she did receive her commission through Naval Reserve Officer Training Corps in 1988, and she also earned her Wings of Gold in 1989. She was, as I mentioned, the head of the Provincial Reconstruction Team in Farah Province. And it was also in that capacity, in fact, that she had a number of women on her team, including security personnel, medical staff, and they extended that access during her time and treatment capability to women who might not otherwise have been able to access those services, those healthcare services in Farah Province. So we're very, very interested in hearing in detail about her experience, about her time on the ground. So let me first welcome you, Admiral Shoshana Chatfield. Thank you for coming and being here today with us. We'd like very much to hear you describe your tenure as the head of the Provincial Reconstruction Team and as commander there in Farah Province. How did your work specifically build trust with the local community and also improve health conditions? Give us a feel for that, and welcome to you.
Thank you, Ambassador. And I just would like to confirm that you can hear me. I think we did the sound check, but I'm seeing good indications. First of all, I would like to start by saying that my team was 115 military members and myself and 3 interagency partners as the head of that team working with me to decide what we were going to do, to create a strategy for the time that we had, and to hopefully leave that province a little bit farther along toward establishing trust between the people of the province and their legitimate government. I was grateful to the United States Army who trained our team, and we were an ad hoc unit. We were an ad hoc unit that comprised of 66 members of the 3 of the 103rd Pennsylvania National Guard, and they knew everything about security. And then we had 38 Navy active duty and reservists who were not used to operating on the ground. And we went through quite a comprehensive introduction to, first of all, being a ground unit, and secondly, how to organize and plan around the concept of the Provincial Reconstruction Team. And then lastly, we were part of a coalition. We are in Afghanistan with a coalition, and we have common objectives there. And those objectives were around a counterinsurgency strategy. And so we knew that everything that we did to re-establish stability within the province would in fact have outcomes that would affect the lives of people living in Farah Province. So I hope that answers your question.
You certainly, Admiral, you certainly have given a very good feel for what was the situation on the ground, the level of your support, etc. Let me take it a step further, that while you were leading the Farah Province PRT, you were, as I understand, responsible for a field hospital that not only treated US military members, but also Afghans who lived nearby. And, you know, there's a kind of cultural preference in Afghanistan for women to be seen and treated by other women. Give us a feel for how you, your team, addressed some of those kinds of challenges to healthcare access.
Well, again, our unit was an ad hoc unit. So the Provincial Reconstruction Team came in with a Role 1 capability, but there was a Role 2 capability on the camp, and I was the FOB commander. So there were a few other units that resided on that camp or near that camp who could also contribute medical personnel. And we had a Army surgical team on a much shorter rotation, just a 3-month rotation, and those were Army reservists. So together, we could build quite a robust Role 2 facility there. However, my team had a really wonderful commitment to partnering with our Afghan counterparts. So we really felt that it would be far more productive to use that linkage with the representative from the Ministry of Health and the local representatives from the hospital, the medical staff there, to create a cohesive group who would think about the health requirements. So the last choice was to bring people onto the camp to treat them at our facility. The first choice was to partner with an Afghan provider to provide capabilities back into the community. And whether it was my team led by Lieutenant Commander Bill Swart or Lieutenant at the time, David Nita, or our wonderful complement of physician assistant and hospital corpsman. And we had just so much of a capability, which was expanded by having women within that group and additional women on our team so that we could conduct the appropriate level of screening, whether it's a screening at the reception area for a medical clinic that we are running, or whether it is somebody who's going to come onto our camp and have a meeting in a much larger sense, or whether it's my group who are going to go and do grand rounds with the hospital staff at Farah Hospital, and then organize around developing a capability for a mass casualty plan. Those things that were done in partnership built capability, reinforced the legitimate government structure within that province, and was in concert with the governor's development plan.
So it sounds like that you actually have been able to build some trust. That's what it sounds like.
Well, that's always really hard to measure, but I think we did build some trust. And I do have connections. Now, I was there in 2008 with my team, and I'm still connected to many members of that team through Facebook. And members of my team in that medical staff remain connected to doctors in Farah, Afghanistan. And when there's a little win that happens there, there's a communication that flows back and forth. And for me, that the enduring nature of that relationship is telling of one small part of the effectiveness of our team. And when I think about what it takes to take that little piece of trust and what it takes to build it, first of all, to support ourselves in a non-permissive environment, to establish a camp, to maintain the security of that camp, to provide services on that camp, to feed, provide water, provide safe transportation to and from the city of Farah or the district centers. The contribution of each member of the team holds a really important piece of any lasting improvements that we made.
All right. Thank you so much. Let me go to our next very distinguished panelists, and we welcome you from Kabul, Diwa Samad. Diwa, as in fact our Executive Vice President Damon Wilson had mentioned, is serving as a special aide for President Ashraf Ghani, with the focus on healthcare reform and human capital development needed for social and economic growth in the country. She also served previously as the Deputy Minister of Policy and Plans at the Ministry of Public Health, where she led the government initiative aimed at increasing vulnerable communities' access to healthcare and ensuring quality of care using pay for performance models and designing programs that would result in increasing access to family planning and mental health, among other areas. And let me just mention, too, if I may, as a profession, she is a development economist with expertise in public policy, very impressive, health economics, and effectiveness and program evaluation. So we are really, really very delighted to welcome you from Kabul today. And I'd like to go first, if I may, Diwa, from you, to hear you've had extensive work on health programming and planning in both the Afghan government and also as part of civil society. So, from your perspective, what would you say have been really the greatest successes? And by the way, why? Why did you have a success? And welcome to you. And please do put your mic off.
Thank you, Ambassador. I'm glad to be connected with you all. I would respond to your question firstly using personal experience. Being part of a generation born in war and raised in post-Taliban Afghanistan, I would like to give you some examples based on my personal life that describes where we were 1 or 2 decades ago and the progress we have made since then. First, the story of my mom, who struggled, for example, to obtain basic care at the time of delivery. I was born at a time where Afghanistan was at the last year of civil war, and health infrastructure was fully destroyed and access to care was minimal. I was born at home, and my mother always tells me that how tough it was for her, given that she had pregnancy-related complications and she almost lost her life. We were lucky that she survived, but thousands of other Afghan women lost, and they still are losing lives on a daily basis due to lack of access to basic health services. A second personal example is of the story of myself and my siblings and how we were brought up in Afghanistan, and the fact that we couldn't get access to vaccine and we struggled with pneumonia and many other preventable diseases. Absence of basic health services in Afghanistan back then made so many Afghans families refer to traditional medicines prescribed by local elders. For example, I still recall that instead of routine hepatitis immunization, people would refer to some traditional treatment centers to treat that. I remember that going to one of them when I was younger, at the age of 5 and 6 year old, and they would treat you in a way with onion, with other homemade interventions, because access to care was very minimal. So that's how thousands of Afghan children died before age of 5 in the absence of such basic routine immunization and other health services that were provided to them. And many other were malnourished and they could not reach to the best of their mental and physical abilities. And one is the final story of how Afghanistan health system changed in the post-Taliban era, where Ambassador, you referred to the data points. I will not repeat the significant progress that we have made in terms of access to care, in terms of the number of health workforce that has been trained at the national level, at community level. But I want to hint to few programmatic interventions that were proven successful in Afghanistan, which was led by government with support from our international partners. A designing of BPHS and EPHS, which we call the basic package of health services, an essential package of health services back in 2003 and 2005, our successful intervention in healthcare in Afghanistan that increased access to care to more than 90% of the population throughout Afghanistan within 2 hours of walking distance. At the same time, more than 3,000 health facilities were established throughout the country, including at district level. At the most remote areas of Afghanistan, you can still see health posts equipped with midwives and basic routine services in the country. At the meantime, with government's intervention to support private sector, we have thousands of facilities established by private care providers. And today in Afghanistan, laparoscopic surgery and open heart surgery are not impossible anymore. Our private sector there are a few hospitals that can do these operations today. In terms of leadership of women themselves in health sector, we had 2 ministers of health, 4 deputy ministers, hundreds of mid-level managers. More than 30% of health workforce today are women. And not only within the Ministry of Health, but if you look into the data from how women and healthcare has transformed into our military hospitals, and how women are contributing and providing care to Afghanistan security and defense forces is impressive today. So community-based intervention, demand-side financing, programmatic approach to healthcare were few of the programs that I can name that has been proven successful, that changed the landscape of healthcare in Afghanistan compared to what we had 2 decades ago. The changes today are very impressive. I hope I've answered your question.
You have more than answered my question. First, thank you for sharing your own, not only your own story, but that of your family. I mean, it truly is in stark contrast in terms of then and then, as you've discussed and referenced, I mean, the kinds of changes that have taken hold. So let me take it a step further. That raises the question of, one, how do you see the priorities now, given where Afghanistan is now in terms of healthcare, and how these changes have evolved? What are the next steps? And also, how has COVID really impacted the situation on the ground? How are you dealing with that?
Thank you very much. I think despite immense progress that we have made in healthcare, I mean, what I presented before was a relative comparison of where we were and where we are standing right now. But then there is also another, how we look into it in terms of where we should be is the question. That's where how the government is reshaping the priorities when it comes to healthcare. That is linked with few factors. Of course, we're taking into consideration the changing context of disease in Afghanistan. NCD is rising in Afghanistan, and more than 30% of deaths are accounted for non-communicable disease in Afghanistan. That's the new reality that the government and our healthcare system is dealing with. Of course, trauma and conflict-related injuries is another issue that the Afghan health sector is dealing with it, and it's being considered in government's healthcare programming. With mental health as well as another important arena that government has been providing increasing attention to, with providing support to psychosocial counseling and integration of some mental health related services into our basic package of health services is an example of government's commitment to enhance mental health services throughout the country. The other area where the government that impacts our planning when it comes to healthcare is IDPs, internally displaced people as a result of conflict, returnees, add also to the way we plan health sector and how, in terms of it changes governments programming and planning. So with all these drought, environmental issues, these are the type of different contexts that the government is dealing with it. And of course, recently is the COVID-19 pandemic. His Excellency, the President of Afghanistan, has launched a comprehensive reform plan for the health sector, which is focused on responding to COVID-19 pandemic as a priority, but also health system reforms and reprogramming our national healthcare and adjusting it to the new realities of Afghanistan over the past 20 years. With reference to the question you asked with regards to I mean, before I speak about the pandemic, another important component that is important for government as a priority. Back then, in the past 20 years, our focus was mostly into expansion and increasing access to care. But with increasing awareness of people in Afghanistan, and also quality of care is another component that the government is focused on. While 2 decades ago, access to a simple painkiller were basic expectation of Afghan population, but today the expectation is that the government needs to provide quality of care at least to the level of neighboring countries. So change in demand, that's a good news for us because it shows how people are more aware and in terms of changes in health-seeking behavior of Afghan population. So establishment of Afghanistan Medical Council, Afghanistan Midwifery Nursing Council, Afghanistan Accreditation Boards exemplifies some of our efforts in terms of enhancing the quality of care. And also from a financial perspective, what the government is dealing right now with is a very, very high out of pocket expenditure. More than 75% of Afghan people are still paying out of pocket. So we are, as part of His Excellency's the President's reform plan, a reduction of out-of-pocket expenditure through provision of appropriate provider payment mechanism, and also and establishing the right collaboration mechanism with private sector. It's being revised. In terms of COVID-19, although COVID-19 was a shock to the health system and to many countries, both in terms of health and economic, but as a healthcare professional, I also find it as an opportunity where we understood what were the key weaknesses in our health system. It brought an all-level attention to healthcare in Afghanistan and a broader political attention to healthcare and the need for healthcare reform in the country. What we learned, although His Excellency the President's and Afghanistan government's a 5-pillar strategy to contain and cross-sectoral collaboration approach and to an extent contain the virus with relatively lower mortality rate in Afghanistan. Of course, the other important factor was a young demography and a young population in Afghanistan, but it still taught us that we need to do a lot more in terms of our community-based interventions, specifically surveillance systems needs to be strengthened. We also, it taught us that how should we increase the resilience of our private sector to be able to better cope with the pandemics in the future. We also, it brought us to our attention that we need to invest in our hospital care as well. When the COVID-19 hit at Afghanistan, we only had 100 ICU beds, but recently the government has increased investments on health infrastructure as well. We also, it taught us that should we increase women access to care. If you look into the data from Afghanistan, number of women who were tested positive is relatively lower, which indicates we have a lot more to do to increase women's access to healthcare and specifically in, of course, diagnostic services and specific. And at the same time, it taught us how should we focus more on provinces and districts and move resources from central ministry to frontline workers. So learning from all these priorities, our national health reform plan is being revised by His Excellency the President and is about to be launched in the coming few months with specific targets to be achieved over the next few years.
Thank you. Very comprehensive answers, and thank you for that. I want to go to our other very distinguished panelist to give her a chance also to give her perspective. And let me introduce her. She's Ms. Miriam Bayat, who is the director of the Bayat Foundation, which is a charitable organization that has truly improved the livelihoods, quality of life, and human security for at-risk Afghan people through more than 500 projects, which have been dedicated to building capacity and also infrastructure for every man, woman, and child in Afghanistan since 2005. I want to also mention the Bayat Foundation has built 13 hospitals and other medical facilities across Afghanistan and truly has formed a network of care facilities that have treated nearly 3 million patients since 2006. And Miriam Bayat has also served. She's been on the board of trustees of the American University of Afghanistan. And if I may say, I've also have had the privilege of serving with her on that board. And I want to mention that she has also continued one of her passions in terms of helping Afghan people by playing a very key role in hosting Afghanistan's first ever conference that's focused on ending modern slavery of men, women, and children held in bondage in Afghanistan and throughout the world in partnership with the Bali process in November of 2019. Miriam, it is a real pleasure seeing you and inviting you here today. We want to get your perspective also on this very important issue. And I think maybe a first question for you is how and why did the Bayat Foundation even get involved in women's health projects? What kind of work are you doing to improve women's health and healthcare access? Give us your perspective and no less the work of the foundation, and welcome today.
Sure, Ambassador. First off, I want to quickly thank the Atlantic Council for including me in this important discussion. And I'm honored to be among this esteemed panel with Admiral Chatfield and Ms. Diwajan. And wanted to just thank you all for contributing toward better healthcare for women. Women and maternal health has been a top priority for us at the Bayat Foundation since our establishment as a foundation 15 years ago. As you all know very well, women play a vital role in stabilizing Afghanistan, especially at the foundational level. I mean, they are the backbone of the nation. These women are the ones who will be giving birth to and potentially raising the future generations of Afghanistan. When we first came to Afghanistan, the maternal and neonatal mortality rate was much higher. Mothers were afraid of childbirth because they could potentially lose their life due to lack of facilities, lack of transport to a facility, lack of equipment, lack of basic knowledge. If the downward trend of maternal mortality continued, there would perhaps be no future generations, there would be no Afghanistan. So my father, Dr. Bayat, and mother were both determined to make Afghanistan a safer place to become a mother and created the Bayat Foundation with this original mission of filling in the gaps of maternal and neonatal care. And since 2006, Bayat Foundation has built, helped renovate, and equipped more than 13 hospitals in rural areas throughout Afghanistan, which has, I'm excited to share, has treated up to 3 million patients up to date. In fact, in partnership with Matter NGO, we're currently in the construction process of Afghanistan's most up-to-date and fully equipped women and neonatal hospital in Kabul. And this new hospital will address concerns of pediatric cancer, of cervical cancer, which is now a main concern for Afghan women, another main concern for Afghan women, and obstetric fistula, excuse me. Thanks to the assistance of the U.S. Air Force, Denton Humanitarian Airlift Program, and Feed My Starving Children, we've been able to address concerns of vitamin deficiency in both infants and adults alike with the vitamin and mineral packed rice meals. Thanks to Denton, we will also hopefully within the next few days receive about 70,000 new mother kits, which will help Afghan mothers, new Afghan mothers, to assist with newborn hygiene. And our unique partnership with the Starkey Hearing Foundation. I think we have a photo here of our hearing mission in Afghanistan. It's given us the opportunity to bestow hearing to over 8,000 Afghans since 2014, many of these patients being women. And actually, one of my most memorable experiences, ambassador in Afghanistan, was during a hearing mission. We had restored hearing of a young mother, and she just immediately broke into tears. It's actually one of my favorite stories, and she was just so grateful. And I'll never forget her words. She said, "My baby would cry for hours through the night, and I wouldn't even know. And now I'll be able to hear my baby through the night to feed her." I mean, something we take for granted, but how something that was curable helped change the life of this mother, and in turn will drastically change the quality of life that they previously had. So that is some of the work that we're currently doing. I hope that answers your question, Ambassador.
It does. And let me also ask if you have other slides. Of course, I hope that as we go along, you will share them. Let me go to another question for you. And then, by the way, I do want to say a few words after speaking with you. Before I come back, we do have some questions that are coming in. I want to say a few words about our sponsors today, but I had wanted to save it a little bit into the middle for a number of reasons, and you'll see why. But Miriam, let me ask you, how does the Bayat Foundation actually prioritize or choose the areas of women's health that you get involved in? Give us a feel for that, and do take us through still a number of your slides.
Um, as with everything the Bio Foundation does, we base our actions first on need, then leadership, and then scale. Need, we want to help those most at risk. Even if others say it can't be done or hasn't been done, we try and make it happen. Throughout the process of our projects, we seek and are responsive to input from the local community in both the planning phase, the preliminary planning phase, and through our implementation. And we try to tackle areas that are most necessary. An example of scale, we believe strongly in maternal and early childhood health, because a strong, healthy start can pay dividends. And this is not just health wise, but economically and socially as well for years to come. Healthy mothers will raise healthy children. In return, you have a healthy society. And this is both physical and mental. And in terms of leadership, we believe that disabilities are often, unfortunately, a forgotten area in Afghanistan's health sector, especially for women. And this is what's given risen to our efforts to tackle issues such as hearing impairment. Not only does this address the lack of trained audiologists in Afghanistan, but providing the ability to hear gives an individual a real chance to study, to work, to engage productively in society. And I don't want to take too much time here, but another area not addressed as much as it should be, as I mentioned before, obstetric fistula. This is a significant injury that often occurs during childbirth. And this is a result of prolonged and obstructed labor. And because of this sensitive nature of the issue, many Afghan women don't even know that this is a medical condition that can be diagnosed and cured. Instead, they're suffering quietly. They're limited by lack of information, lack of knowledge, inadequate accessibility to trained doctors, and the social stigma of it. I mean, it's embarrassing for them to come forward that they have an issue like this. So this is an injury easily repaired by surgery when it's diagnosed, and our new hospital will hopefully significantly decrease these cases in our designated fistula theater.
All right. Well, thank you, Miriam. Let me pause for a minute. We have a number of questions, and I'm going to go to them in a minute. But I do want to mention how interconnected we are. And I first had wanted our panelists to speak, but we are extremely interconnected. This program and the series actually has been put together by a number of co-sponsors, the Atlantic Council being one, and we're very appreciative of the Atlantic Council, and I'm very proud to be affiliated with the Atlantic Council. But we also want to thank, by the way, the U.S. Afghan Women's Council, which has been there from the very beginning. Dr. Phyllis Maghreb, who is a vice chair of the council, and she's with us today, and also the executive director, Sarah Greengrass. I just want to give a shout out to you because you've been really hands-on, very engaged, and this issue has been a key issue for the U.S. Afghan Women's Council in terms of the work and also the sponsorship here with the Atlantic Council. Both Miriam and I happen to be members of the U.S. Afghan Women's Council. And in fact, if I may say, I was there from the very beginning. And so thank you for that sponsorship. And we will be hearing at the end some concluding remarks from one of our other sponsors, from Susan Yoshihara, who is the founder and president of the American Council on Women, Peace, and Security. And then I also want to give a shout out to Charlie Ponticelli, who also is a member of the U.S. Afghan Women's Council, and who also, by the way, has been engaged in this series. And she is spearheading and engaged with the American Committee on Foreign Relations. So just thank you all. It's very important, and the work that's been done has been very important. I want to go to one of the questions that in fact has come up, if I may. And the first one is, it's in fact for you, Diwa. It's from Shabana Akbari. And specifically, she asks the question, what are the government's plan for addicts? It's a very serious problem in Afghanistan that needs public health attention. Would you comment on that? And maybe as you comment, could you also say a word about how women fit into that space, if you have data on that? Thank you. Over to you.
Thank you very much. That's such an important arena. Yes, number of addicts in Afghanistan, unfortunately, it has increased. And most recently, we do not have precise data on women, but the most recent data shows that the number of women who are addicted are on rise as well, especially in prisons and in other some western parts of Afghanistan. The number of addicts are increasing. The government has taken various steps in terms of reducing this number through. Of course, there are long-term vision for reduction of drug use in Afghanistan, which goes back to how we manage and reduce the supply and how Afghanistan turns from a narcotic producing zone into and how we can formalize our illicit economy. But in the short term, there are programs of care for drug addicts as well. We have a number of projects that are being run at the ministry. We have I cannot recall exact numbers, but we have treatment centers, drug treatment centers at all provinces of Afghanistan. But we agree that this needs to be further escalated. We have a few hundred beds center for drug addicts in Kabul as well. But these interventions need to expand, and government is well aware of this, and it's going to be reflected in our national programming, and it will be expanded. Thank you.
Thank you for that. And also, Shabana, thank you so much for the question. I have also a question next for Admiral Chatfield, and then I also have one after that for you, Miriam. But let me go to the Admiral first. And this one is from Megan Goyette. And she poses the question, she says, as the United States reduces its military presence in Afghanistan and the presence of the Taliban reemerges, how do you see the rights and protection of the needs of Afghan women being preserved in the future? Many people are anticipating the redesign of Afghanistan and its political order to reduce the rights that Afghan women have obtained over the years. How do you see it, Admiral? Over to you.
Well, it's a really good question and quite a complex question. From my perspective as a military officer, I think about the importance of a negotiated political agreement to address these issues. As a military officer, I think about our partnership with our NATO allies and the government of Afghanistan, and our role in preventing violent extremist organizations utilizing the territory of Afghanistan to do violence to the Afghan people or to our nation or another nation. And so the policy issues really depend on stability. And stability is quite complex, and it depends on all parties upholding their promises to maintain stability and to avoid the kinds of conflict that will prolong this situation and have such a terrible effect on the population inside of Afghanistan.
Megan, I'm going to add one thing to the Admiral's comment, because the Admiral exemplifies in her work on the ground when she was commander of the PRT in Farah province. I think it underscores the kind of commitment that also people like Admiral Chatfield have had towards the progress of Afghan women and have looked for ways of advancing it. And so I'm certain saying, and because of her presence here today, I know that she will also remain committed as we go forward and with the challenges before us. And as she described, that commitment will be sustained. Let me go to the next question, and it's from Dr. Laura Lederer, who's an expert, truly an expert, author, a former government official dealing with human trafficking in persons. Hers goes to you, Miriam. She has the US Department of Defense's Combating Trafficking in Persons Office has been very involved in preventing trafficking in government contracting in Afghanistan, especially labor trafficking in the provision of services to our military installations. What are the other kinds of human trafficking prevalent in Afghanistan that the Bayat Foundation is addressing? Over to you, Miriam.
Thank you, Ambassador. This human trafficking, this is our modern slavery event. This was not just human trafficking. It was human trafficking, modern slavery, labor exploitation. We see young children who are on the streets begging, and most often or not, these young children are working for other people, and half the time they're not even they're not getting the wage that they should be getting, first of all. Second, they're under the age that they should be working, and because of this they are missing their chance to get a proper education. And another issue is underage marriage. This practice itself manifests not just in health issues, but inhibits a young Afghan woman's chances to go to school and to receive a proper education. So these are some of the other issues with human trafficking and the modern slavery.
All right, thank you. I want to try to get in. There are three other questions that have come in, and let me go through them. First, I want to take this one from dear Sakina Yakubi. Hello, Sakina Yakubi, and we're delighted that you're with us. Many of us know you and the incredible work that you have done on behalf of Afghan women. She asks, and I think this is for you, Diwa, it's again on the issue of addiction. She says about 60,000 women in Afghanistan who are struggling with addiction. Many of these women are mothers. And how are they going to receive help? And what is the government plan to address this? You already started a bit on this, but can you say a bit more in response to Sakina's question?
Thank you very much. Yes, of course. As I mentioned before, more than, as Ms. Sakina mentioned it as well, more than 10% of Afghan population, they have been exposed to drug addiction one way or another. So it is a serious problem. Afghanistan government, we have taken serious steps towards tackling this. One, as I mentioned before, there are centers that are established within Kabul and provinces as treatment centers where drug users are admitted there and services are provided to them. When it comes to specifically women, there are thousands of women, as it was highlighted by Ms. Yacoubi as well, that are addicted to drug use. For them also, government runs a very, very large project that is being run by Ministry of Public Health, drug demand reduction initiative of the government, which has presence in 34 provinces. And we have centers that are specifically devoted for women. They have the right space, and many of them are mothers with children. So government is taking this kind of initiative as of now, but in terms of prevention, various community outreach program has also initiated in mosques, in schools, within communities. So we increase awareness and prevent it. But for those who are addicted, these centers serve as a rehabilitation centers where they receive treatment for a year or so, and then they are under strict monitoring. But that's not enough. I believe these interventions needs to be expanded, and the government is working to expand that under its new national health strategy and the new program that is going to be launched. Thank you.
All right, thank you. We're going to have to do a little bit of a rapid round because we're getting to the end. And so I'm going to begin with the Admiral, and I'm going to pose two of the questions that we have. We'll go to you, then we'll go to Diwa, and then we'll go to Miriam. And we really only have about 3 minutes. So very fast, 3-4 minutes before I need to turn it over to Susan Yoshihara. So let me begin the two questions. Abby Donnelly asks a very good question. She wants to know from all of you, what advice would you have for students who are passionate about helping women and children in Afghanistan? How can students make an impact and connect with women and children across the globe? And then a second one is from Jack Kelly. How will a potential peace agreement in Afghanistan impact Afghani women and the strides they have made to date? So Admiral, let's go to you first. If you don't mind, try to give a very pithy response, if you can, to both.
Well, thank you for the question, because it's so important, first of all, not to not slide back. To any motivated student, to any motivated person who wants to become involved, there are a lot of people who are already involved and who have many years, which means many years of understanding and relationships within Afghanistan and in the context of that population. And it's very hard to come in with an outside viewpoint and from an outside culture without taking the time to invest in understanding all of the complexities of what constitutes stability within a society and how long it actually does take to make lasting change in the development and reconstruction world. This is a long-term challenge, and the solutions must also be long-term.
All right, thank you, and thank you for being brief. Dua, to you.
Thank you. With regards to the first question, of course, in terms of the second question, I'll go and answer it. In terms of a potential peace agreement and how it will impact Afghanistan women. As an Afghan woman, we are very cautious, and we have our concerns regarding the ongoing peace negotiations. The number of attacks on health facilities, the recent attack on a maternity ward in a hospital in Kabul, attacking education centers, and that is really concerning. Although we are looking forward for a sustainable and just peace, but Afghan women rights and our gains in health sector is something that should be a priority agenda in our ongoing peace negotiation that is held in Doha. With regards to how students can cooperate with us, I would say in terms of research, the health sector is a very data-rich sector. Research and assessing our programs using the data and giving us feedback in terms of how we move forward to make sure we make evidence-based decision-making moving forward.
Thank you. Miriam, if you could just take 1 minute. And so Susan will get a chance to close.
No problem. Our best advice is simply not to forget Afghanistan and Afghan women in particular. There are always reasons organizations leave or choose to pass by Afghanistan. That's security, donor fatigue, so on. But to address Abby's question, bring awareness, support local organizations that you trust. The need is real, and I strongly believe that together we can make a difference. In Dari, we have a saying that a clap cannot be heard with only one hand. I think it might have been lost a little bit in translation here, but hopefully you get the general idea that basically we can truly receive the outcome that we like by working together.
Thank you all very much. You're a very distinguished panel. My apologies to our viewers. There were a number of outstanding questions that we didn't get to. There's never enough time, but I'd like to now turn it over to one of our sponsors. And let me remind again, this was sponsored by not only the Atlantic Council, but also thank you to the U.S. Afghan Women's Council. And now we're going to hear from Susan Yoshihara, who is the founder and president of the American Council on Women, Peace, and Security. Over to you, Susan.
Thank you, Paula. Thank you, Ambassador Darbryansky. This has been a terrific event. Thank you to the Atlantic Council, U.S. Afghan Women's Council for amplifying women's voices today. God willing, we'll all be together next month as we continue the conversation when we focus on women's leadership. I'm going to frame my remarks in the 3 parts of the Women, Peace, and Security agenda, which you may not have heard of. It's an approach to security that started at the UN Security Council in 2000, 20 years ago, and was passed into law by the US Congress in 2017. My organization, the American Council on Women, Peace, and Security, is dedicated to that law's bipartisan implementation. One of our current projects is we've designed and we are instructing a curriculum at the Defense Security Cooperation University. We also conduct research. We believe in amplifying women's voices, letting them speak for themselves, and also we focus on the protection of children born into war. So please visit us at wpscouncil.org. Now, a few brief remarks along the lines of women, peace, and security. And let me start with security. We've heard today that security sets the conditions for access and access to healthcare in particular. We heard today from Dua Samad that the period of US security provision correlates to significant improvements in health infrastructure. And in turn, good health, and that means access to healthcare, is a precursor to and a buttress for security and stabilization. I think Admiral Chatfield made that very clear. It's a virtuous cycle. Now about women, civilian and military leaders make better decisions and sounder plans when they listen to all of their society, all of their citizens, women as well as men. Women bring something unique and different to the table that would be missing if they weren't there. We clearly heard that today. Protecting health is not just the right thing to do, though. It's also the strategic thing to do. I mean, after all, we are depending on Afghan women to welcome former fighters, heal communities, build economies, and raise their families. But how can they do that if they're still suffering the physical and mental wounds of war? Getting the health component piece of stabilization right is absolutely essential. And that leads to a sustainable peace, the third part of women, peace, and security, something that we are all longing for. We know that good health is an essential part of conflict prevention, and prevention is often going missing when we talk about peace building and peacekeeping. Afghan children born today are the future of that nation. We're glad that maternal and neonatal health is improving, but we need better health care if we're going to avert systemic public health crises, which could then destabilize a fragile peace. So, good health empowering individuals, families, and communities. That's what the good news is. That's what we want to hear in the future. And I'll bet some of us today didn't know about all the great work of the Bayat Foundation. We didn't know the good news about the critical infrastructure being built, even despite the war in the last 20 years, according to Diwa Salman. And we probably didn't know how, as Admiral Chatfield told us, just having women on the ground in the US forces often affected for the better health and other things in hidden and unique ways. So today's event finally helps show us that civil society and governments can work together in their civilian and their military components. We can focus on teamwork and partnership to advance health, obtain security, and secure the peace. That's through women's leadership and protecting and helping them thrive. Thanks again for joining us. I'm Susan Yoshihara. Good day to all those in the United States And to those in Afghanistan, a very good night.
And I'd like to just say in conclusion, thanks to you, Susan, the American Council, thank the U.S. Afghan Women's Council, and of course, the Atlantic Council, and our very distinguished panelists. Thank you for coming today, no less our viewers. We really, really felt this is a key topic, and we're just appreciative of you all being here. Thank you.